Welcome again to the Daily Brief on Milwaukee's health and economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'll be joined in a moment by my colleague, Dr. Raymond, the president of the Medical College of Wisconsin. Each day at 3:30, we bring you a fact-filled 19-minute update on the health and economic impact of COVID-19. And this, of course, is powered by Aurora WDC. So just a couple of program notes. One is that if you register for this program now, you'll be able to register for the entire month of April at one time. And tomorrow we'll be joined by the mayor of Milwaukee. So with those two updates, I'm going to turn it over to Dr. Raymond to take us through today's update. Dr. Raymond?
Thanks, Tim. Before we get to the numbers today, I want to remind everybody that our goal is to never reach a time when there's a shortage of hospital resources here, especially ICU beds and ventilators for patients in need, and that Milwaukee's at the greatest risk in the state given our large population concentration. And up to this point, we've been following a curve of cases and doubling rates similar to New York, New Orleans, Detroit, and Chicago in the early phases of their pandemic. But we may be trending in the right direction because we intervened a little bit earlier than those communities did. The most important action that we can take is to urge for continuing compliance with safer at home, as our region still has several weeks more, perhaps a month more of difficulties before we reach our projected peak and start to go out on the other side of this pandemic. Action now will enable us to recover our economy and the health and well-being of our people more quickly in the coming weeks and months. Now, the scorecard for today shows stable to slightly favorable growth rates and doubling rates here in Wisconsin and Milwaukee, with a daily growth rate of new incident cases of about 16% and doubling times of 4.17 days in Milwaukee and 4.35 days in Wisconsin. I draw your attention to the 180 new positive cases in Wisconsin, which is less than the 199 reported yesterday, but still reflects a significant burden of new cases that, if continuing at this rate, will overwhelm the capacity of our health systems. Now, clearly the trend is stable to slightly favorable compared to last week, but we need to flatten the curve even more, out past a week and perhaps even 2 weeks of doubling time, or we'll still exceed the projected surge capacity of ICU beds and ventilators in our region and our state. Indeed, some of the models are projecting that next week or the week after that, we'll have reached our capacity. So this is not the time to loosen social distancing standards or to relax safer at home interventions. I'd like to go to the next slide just to talk a little bit about some therapies. Next slide, please. The FDA stood up an expedited process for the development of treatments for COVID-19. And as we said yesterday, there are about 35 to 40 companies and universities working on vaccines, and even more who are investigating multiple different experimental therapies. Those fall into three main categories: the repurposing of drug therapies that have already been developed or are in the pipeline for other uses like Ebola, malaria, and arthritis; convalescent plasma or antibody therapy using the serum or plasma from people that have recovered from COVID-19; and then natural killer cell therapy, which is a new therapy under development. If I could go to the next slide, please. So drug therapies under development include antiviral drugs like remdesivir, which treats specific viruses. And remdesivir was originally developed for Ebola and has been shown to have some effectiveness in other coronaviruses like SARS and MERS. This drug will likely only be used for the critically ill. Other drugs are symptom focused and have effects like reducing lung inflammation or improving lung function. And some of those are arthritis drugs in the category, and those are shown on the right side of the slide. I do want to talk just briefly about the anti-malarial drugs, hydroxychloroquine and chloroquine. These are in human trials, and there are some concerns about using these drugs without FDA approval or without having a large clinical trial, because they do have numerous severe side effects, and there have been some people that have ingested excessive amounts and have died. So we need to keep that in mind. Although there is some promise that these drugs might be helpful, they're not going to be a magic bullet. Also want to talk a little bit about plasma and antibody therapies, if we could go to the next slide. As we mentioned, the whole idea of plasma or antibody therapy is that you use convalescent antibodies or plasma from individuals who've had COVID-19 infection and have recuperated. Or you could just isolate specific antibodies from them that attack the virus. The challenge for us right now is we don't have that many people in the US who've clearly convalesced. There are some in China, and some of the sera and the antibodies are available and are going into very small clinical trials right now. That may be something that is useful if we have a second pandemic in the fall, but probably not a realistic therapy right now. There are some recombinant antibody therapies that are in the pipeline, and there's been some press about one that was developed in the early 2000s for a different SARS virus that might be repurposed in the short term. So stay tuned for that. And also, you're going to hear more and more about RNA therapies that use interfering RNAs to stop the production of the virus, because it's an RNA virus. And human trials aren't really planned for that latter group of therapies yet. So again, I thank you for allowing me to have these few minutes with you. And I want to make sure that you know that tomorrow we'll be showing the week-long trends of our doubling rates, which should provide much better information because you'll have longitudinal data to track how we're doing as a state. So thank you, and Tim, I'll turn it back over to you.
Sure, Dr. Raymond, a couple questions, and just kind of teeing off what you mentioned. If I look at some of the data worldwide, 262,000 closed cases, about 20% have resulted in deaths, and about 5% in hospitalizations. So how potentially would the drug therapies that you're talking about, how would they work in that mix?
Well, if we can get an inexpensive drug to the front lines that we can deploy either for prophylaxis or help with prevention, or to treat critically ill patients, we might not have that huge death rate. And Tim, you pointed out something that I haven't really heard anybody talk about in public. If you look at the Worldzometer data, where they do track the active and resolved cases, it's pretty alarming. 20% of the resolved cases are death. Part of that, I think, is because the health systems in China and in Italy were absolutely overwhelmed, and many people were dying at home without even having the opportunity to be hospitalized. So again, not only these drug therapies, but the social distancing interventions might help us have better outcomes.
Yeah, that's a very good point. And we talked yesterday about vaccines, and again, the timeline on that is much further out.
It is. In fact, there are a lot of clinical trials that are being rolled out in May, June, and July. But remember, it takes time, even in an area where you have a lot of cases, to test the effectiveness of the vaccine in a human population. That could be months. And then they have to ramp up production and distribute the vaccine and then administer it. So realistically, what we're hoping for is, if there's a second wave of the pandemic in the fall or next spring, that we'll have a vaccine ready for that.
And can you put in context a little bit for us again, the new numbers that came out today that you've reported for Wisconsin and the metro area? And again, looking globally, 71,000 new cases today, 4,400 new deaths, and then in the US, 25,000 new cases and 700 deaths. So as this wave's moving, where are we in terms of Wisconsin and the region when you reflect on that overall data?
Well, we're a week to 2 weeks behind New York and New Orleans, but I think we're doing better. We intervened earlier in that growth curve than those two communities did. And I think that the interventions that you and the MMAC really supported, and that Governor Evers and many of our municipal leaders implemented, are reaping some benefits. But again, this is the time for us to redouble our efforts, because bending the curve down, the doubling curve from a 3-day rate to a 4-day rate isn't going to be enough.
And as kind of as we reflect on that again, Dr. Raymond, we've also talked about what flattening the curve means here in Wisconsin and the 3 or 4,000 hospital beds that are available. And are we going to start to see data in terms of how many new cases, and the hospitalization rate so we can get a sense of that?
I think we will. Internally on our campus, we're starting to have data that you can track on a daily basis, and those are going to be reported as we start to closely monitor our surge capacity for ventilators and ICU beds.
And again, the critical period, and again, I always ask you to look into a future, which is hard to look into, but the next 2 weeks here become kind of a critical path in terms of flattening that curve and the acceleration of the doubling.
Absolutely. The next 2 weeks are essential here for us to get out ahead of it and to not have the same kind of outcomes that they're struggling with in New Orleans and New York. We really have to redouble our efforts. And I know President Trump said we can expect 2 weeks of pain. It's going to be more like a month here because our surge is probably going to be 2 weeks from now.
And so as we look at that, I think one of the challenges that we see, as an economy that's going to be buttoned up for longer, I think, than most people predicted. And so we've had a roadmap that's shown us kind of why we need to put safe at home in place, and we agree with that. What kind of a roadmap and markers are we going to see to get to where we can turn the economy back on, even in phases?
I think that, Tim, that's really going to depend on whether we have a coordinated national response. I don't know if anyone looked at the New York Times today, but they showed a map of the states where people are still traveling, and it's actually quite alarming. And even around us, there's still some significant travel going on in Minnesota and Iowa. And if the states around us don't coordinate with us, there'll be secondary waves that come back into our state, even if we do a great job. And the Southeast in particular, there's very little travel restrictions. And I think that's going to be a long-term challenge for our economy. We need to synchronize our response so that we can get through this rapidly.
Well, a good message, and I hope the governor is listening and we can coordinate that with the surrounding states. Chris, questions from the audience?
Yeah, we have plenty for Dr. Raymond. One of the first ones is, do we have any data either from the US or maybe overseas of people who have recovered and been able to leave the hospital? And what potential is there for that to relieve capacity issues?
Oh, great question. And the answer is yes. Most people do recover, even those that are hospitalized. And our early experience here would suggest that we have recuperations that can happen in a few days to a week. So there is some hope. But what I would say is our surge projections do factor in people having a resolution, either dying and leaving the hospital or having some recovery so that they can go home. So what I would say is I want to give you a good answer, but to say the solution isn't just that people are going to be leaving the hospital, because we have more people coming into the hospital than are leaving.
Right. Another question, how long does the coronavirus stay in the air, and can you get sick just inhaling it?
I think the second question I'll take first, yes. You can get ill if you inhale droplets that have the virus. So if someone is coughing or sneezing or talking around you and you're not protecting your 6-foot personal space bubble, it's possible that you could get coronavirus. The second, a lot of information out there. What I can say is we do know that this virus is hardier than we thought it was at the beginning, and that it can persist on surfaces. Maybe not as long on paper and cardboard as on other surfaces, but it can live on plastic. It can live on metals for a few days. So this is something that we all have to be mindful of.
Another question was about people who live in apartment complexes who share elevators and staircases and other things like that in common areas. Are they at a higher risk, and what can they do to mitigate that risk?
Yeah, that's a great question. I would say yes, they probably are at a bit higher risk. So enforcing that social distancing is important. What I would say is small, short periods of time where your personal space bubble, you can't maintain that. Unless somebody's coughing on you, you're probably okay. This might be a case where if you have a mask, you should wear it.
Another question was whether we have real-time data about hospital availability, and if I get sick in Milwaukee and all the hospitals are full, should I go to, say, Appleton?
Good question. I don't think that there's going to be a part of the state that is immune from COVID-19. The surge is probably going to happen within a week everywhere. But each region is coordinating their bed capacity. So what I would say is, first of all, we have amazing health systems here in southeastern Wisconsin, amongst the best in the world. And they're working really, really well together. So if I get sick here, I'm going to want to be hospitalized here.
Another question about hospitalization. Do you know approximately what percentage of positive cases require hospitalization and what the average length of a hospital stay might be?
Good question, and it depends on the community, but the hospitalization rates range anywhere from 5 to 20%, and the real rates probably somewhere in the middle there, maybe in the low teens. Again, we're seeing early on that about 2/3 of the patients can recuperate, and some of those can go home in 3 to 5 days. Some patients who expire do that fairly quickly, within 5 to 6 days. And patients that are in between often require hospitalization for a couple of weeks.
Another question about some of the therapies you mentioned. Is Milwaukee or some of our institutions participating in conducting some of these trials at all?
Well, the Medical College of Wisconsin is actively soliciting participation in a number of the trials. And what I would say is we're lucky right here to have the Versity Blood Research Center, which is the largest and maybe the best blood-focused research institution in the country. And they are looking into trying to lead some of the studies about plasma-based therapies.
Another question about a federal version of the Safer at Home or Shelter in Place declaration. Do you have any reliable information on the possibility of that? And is that something you welcome?
Well, I'm trying to not be political. I have heard, and I think everybody has, that at a federal level, Safer at Home or Shelter in Place order is being considered. My personal opinion is if we don't coordinate our responses, it's going to take us longer to come out of this economically, because we're going to have secondary waves as we clear one community, but the one next to them is going through the pandemic weeks later. You're going to have spread. So I personally would advocate that we need to coordinate our responses, and the best way to do that is by a federal regulation.
Another question about the doubling rate. What would be your target for a doubling rate that is sustainable for our medical facilities?
You know, that's a hard question to answer, because if we get on top of it early, then we don't have the burden of the large number of patients every day coming into the health system. And so you'd be happy with a doubling rate of, say, 5 or 7 days. I think we're kind of past that. We really need to push this out past a week, maybe out to 2 weeks as soon as we can. And what I would really advise is whatever we can do to help the people in Central City, Milwaukee, and in the near South Side slow the spread in those communities, it's going to benefit all of us. We really, really need to focus there.
Had one question regarding medical care. Given that we're sort of in uncharted territory here, will you get the same level or quality or kind of care at different hospitals, or is there some variance?
Well, obviously, I'm biased to the hospitals my faculty work in, but what I would say is what I said earlier here. We have amazing healthcare here in southeastern Wisconsin. There are no bad hospitals. So what I want to do is reassure everybody that the health systems here are working really well together. We have the highest quality of care, and everybody's committed to making sure that we do everything we can to maintain that quality.
Last question here for Tim. Tim, we saw earlier today that the Democratic National Convention has been postponed to August for now. What is the MMAC's perspective on that move?
Well, not to step on a good headline, and having the DNC here in whatever capacity it is, shorter duration, fewer people, is better than not having it. And I think it would be a real boost to our hospitality and retail community. And I think when we have the mayor on tomorrow with Dr. Raymond, I think the question is going to be, do we feel comfortable that that date is out far enough? And probably, Dr. Raymond, you'd say it depends upon how good we are at following through on the orders that are in place now.
Yep.
So, Chris, thanks. Dr. Raymond, thank you. We'll see you tomorrow at 3:30 with a week trend update from Dr. Raymond. And also we'll hear from the mayor on the city's efforts in the DNC. Thank you and have a good afternoon.
Thanks, Tim.